Hi, my name is Bella Angel, and I'm going to be talking about telemedicine. First of all, what is telemedicine? Telemedicine, also known as telehealth, is defined as a type of healthcare in which forms of telecommunication, such as phone, video chat, and broadcasting, are used to deliver healthcare services remotely. Some things defined as telemedicine are as simple as sending and receiving patient test results from doctor to doctor via broadcasting networks or even Wi Fi. These things have become common practice, but in the 1990s, when they were first developed, were revolutionary to the healthcare industry. Now, the revolutionary aspects of telemedicine include real-time telecommunication, which includes remote patient monitoring and specialist referral, and even direct patient care. As with any new technology, there are both benefits and challenges to telemedicine. Some of the benefits of telemedicine include breaking down healthcare service barriers, enhanced care, improved satisfaction, and promotion of meaningful use of electronic health records. Some of the possible challenges associated with telemedicine include the cost of implementation, billing and insurance compatibility, and state-to-state services when a physician is practicing in one state and providing care in another. Though these challenges may seem significant, in reality, most of them are able to be mitigated and are beginning to be resolved over time. Additionally, in comparison to the possible benefits related to telemedicine, these challenges are relatively null and void. One of the biggest benefits to telemedicine are its ability to break down barriers. This includes access to care for people in both urban and rural areas, as well as decreasing cost of care to patients. One study compared utilization in acute care scenarios for pediatric patients in urban areas as compared to more suburban neighborhoods. As you can see in this chart, without telemedicine, the utilization for acute care is significantly lower in inner city as well as rest of city regions as compared to more suburban neighborhoods. After the introduction of telemedicine to those areas, that discrepancy is considerably lower, making the utilization higher. In addition to the increased utilization, it is approximated that 85% of acute care cases can be handled completely using telemedicine without the need for the patient to have direct contact with the physician. All of these aspects makes care more attainable for people living in more urban areas. In addition to making care in more urban areas easier to access, it can also increase accessibility for people who live in extremely rural areas by decreasing the distance that someone has to travel to care. As well as making the care more accessible, it also decreases the cost of care, saving patients an average of approximately $526 in travel costs. This is especially important in more complex cases. In more complex cases, it is often a lot more difficult to obtain care because the higher level of care is usually farther away from the location of the patient. Specialists usually congregate in more populated areas where it is easier for the majority to reach them. However, people living in more remote locations have to travel extreme distances to get care in more complex cases. By eliminating this barrier, patients are able to get better care from doctors who are more rehearsed in that field of study. Specialists are then able to work alongside the patient's primary care physician and other healthcare providers in what is called specialist-directed telemedicine. This is where the specialist oversees the patient's care that is being provided by a more local provider, making the patient have to travel significantly less distance. The graph below shows an example of one study for oncology patients comparing how much distance they would have had to travel had it not been for the use of telemedicine. This study not only looked at the patient's decrease in travel distance, but also the satisfaction of the patients. Patients in this study reported that they did not feel the satisfaction of their care was decreased at all by the use of telemedicine. The results of this study are not alone, however, because other studies have shown that many patients feel that telemedicine leads to either the same or better care, with very few believing that worse care is provided due to using telemedicine. 56% of patients reported being very satisfied by the use of telemedicine, with 29% being somewhat satisfied and 13% being neutral. Only 2% of patients reported being dissatisfied with the use of telemedicine in their care. In addition to all these benefits to patients, the use of telemedicine can also help to promote the meaningful use of electronic health records. This is because the goals of meaningful use, as defined by Medicare and Medicaid services, mirrors the abilities of integrated telemedicine. Similarly, the goals of the two programs mirror each other in the same way. Things like improved quality, safety, and efficiency for meaningful use are similar to the improved quality, safety, efficiency, and reduced health disparities goals of telemedicine. This is no coincidence, and the two systems can be used in conjunction to create a more beneficial process to everyone involved, from patients to providers. One of the proposed challenges of telemedicine is the cost of implementation. This problem, however, can be offset by the money saved from using telemedical systems. As much as $2,600 per patient can be saved using these systems. Additionally, these systems can reduce the amount of staff needed to provide care and cut costs by reducing payroll. Additionally, telemedical systems have been shown to have a beneficial return on investment, with approximately $3.30 earned per $1 spent, and 11% cost savings as a result of using telemedical systems. Another proposed problem associated with telemedicine is billing and insurance compatibility. These problems, however, are already being offset by the use of legislation such as the Bipartisan Budget Act of 2018. This act requires changes to Medicare in regards to reimbursement and coverages associated with telemedicine. Additionally, as insurance companies see the benefits to telehealth, services are being provided by the insurance companies and plans are being included to cover telemedicine. One example of this is through Aetna Health Insurance, which has their own telehealth service provided by the insurance company. This service includes general medicine, behavioral health, dermatology services, and can be used via a mobile application on your cellular device or an online app. The copays for these services are the same as the regular copay for a general practitioner visit or behavioral health specialist as defined by the person's insurance plan. Moreover, telemedical systems can integrate billing into their service, making it an easier process for both administrators at the hospital as well as the insurance company. The final proposed problem associated with telemedicine is state-to-state services. Because different states have different licensing policies for service providers, having a physician practicing in one state and providing care in another has proved to be difficult. However, many compacts have been created to allow expedited multi-state licensure for healthcare professionals and include a majority of the states depending on the different compacts. As more states join these agreements and it becomes easier for licensure to be nationwide, this problem will quickly become null and void. By nullifying this problem, physicians will be able to practice across state lines, which will lead to improved care for patients because they'll be getting the best specialists for their case regardless of their location. In conclusion, as you can see, Though there are some possible challenges associated with the implementation of telemedicine, most of these challenges are easily mitigated and are figuring themselves out over time, and they cannot compare to all the possible positive outcomes of the benefits of telemedicine, such as the positive impacts on providers, administrators, and patients, the revolutionary healthcare being provided, and the improved outcomes of using this technology. Though implementing new technology can be difficult, in the case of telemedicine, the benefits greatly outweigh the challenges.